Right, hello Alan, and thank you for joining us.
Hi Damian, that's
Oh,
good
yeah.
to be here.
Thank you, thank you. Yes, so thank you for joining us on the launch of the Men's Health Unlocked Men's Health Network for Leeds. And I just wondered if you'd maybe like to tell us a bit about yourself and your involvement in men's health, please.
Thank you very much. Well, my background, I'm a nurse, been working in men's health for many years, was fortunate to have a professorship in men's health at Leeds Beckett University until my retirement. Now I'm Emeritus Professor. And alongside that, I was very much involved in the national charity, the Men's Health Forum, and I'm now its patron. And actually being in Leeds was really important because it gave us an opportunity to look at what was happening in Leeds, be supporting what was going on in Leeds. And we've done some great initiatives over the years with the rugby club, with the council, culminating in the opportunity to do the State of Men's Health report in 2016. And that was the first time a city had ever really focused in on the health of its male population. From that, we've had some really important work coming and great initiatives about supporting men across the city. And we were also able to work, I was also able to work with Women's Lives Leeds on the state of women's health. And that really made it obvious how important it was that we look at gender as an important factor in the health of the population. And we've got some amazing work going on with women now across the city, and we've got some amazing work going on with men across the city. And getting the funding for Unlocked was brilliant. It's a really important statement. It's an opportunity for us to celebrate the fact that we've got this work going on in Leeds. It's an opportunity for us to start to coordinate what's happening across the city, and it's brilliant for you to be in this new role. And also for getting more funding for the future. But also the money is giving us a resource that we can give out to the guys who really need it. So the whole package is coming together well to really make Leeds a central city when it comes to the health of its male and female population. So it's great news.
Yeah, great. And what are the key issues in men's health, do you think, in Leeds?
Oh my goodness. Well, if we look at COVID, we've got to look at COVID. Men are at a greater risk of more severe disease and of dying of this disease. And we've got to look after ourselves. We've got to keep that virus at bay. We've got to take all the advice, and we've got to really make sure that we look after ourselves to try and minimize the risk of getting that disease. If we step aside from COVID, if you'd asked me this time last year, I'd have said that we've got some really important issues around men's mental health. We've got a high rate of suicide in men in the city. And we've also got, and this is important now as well, cancer and cardiac disease. And we're knowing that there's a lot of people avoiding going to the doctors, or found it difficult getting to the doctors, or worried about going to the hospital if they've got symptoms. And we need to be getting everybody in the population really to be still looking at their own health in the broader context. And if you've got an issue, getting it sorted. So, yeah. But mental health, I think, is one that we're certainly focusing in on in the city. And there's some amazing work done by the Suicide Prevention Strategy Group. And there's the money that's been coming out of that, the funding that's been coming out of that has made for some really innovative and hopefully very successful work in trying to reduce suicide risk in men.
Because yes, not only was your report, or your two reports, Alan, on gendered health quite landmark reports, but that Leeds suicide audit was as well, wasn't it, across the country in terms of the depth of its analysis. Yes.
They've been monitoring it in 3-year periods over the last decade, and the latest report is still showing that there's an issue for men, and we have got on the back of that some important funding, as I was saying. But it's been looked at as the way you should do it. This is the Leeds City is certainly leading the way in doing suicide audits and raising the profile of it as an issue.
Yeah, and I think that's why I think this network, the Unlocked network, I think is really great as well, because it's another thing I think for taking men's health that it leads that one step further forward as well, on the back of yours and public health teams and all the other great work that's been going on out there as well.
Yeah, yeah, and it's a statement. We've had some enormous success in getting funding for women's health in Leeds. We've got the Women's Lives Leeds initiative, which got significant funding, and then we've got the Women Friendly Leeds, which is a great success for the women's organisations in the city. And now we're starting to see success in getting money for men's health initiatives as well. And I think that is to be seen as actually a huge success. And we've got now an opportunity with the work you're doing to start to build on that, and hopefully to get more funding so we can do more focused work. Because it's not just all men. We've got to recognise that there's different groups of men. We've got to think about the diversity of men, ethnic minority men. We've got to think about sexuality. We've got to think about age. We've got to be thinking about how do we support young men? How do we support older men? How do we support disabled men? And so one pot of funding cannot do all that work. And we've got to be starting to think strategically across the city about how we support men in all these different guises.
Yeah. Yeah, I know some people watching this might be interested in how COVID affects males and females differently, and there are different effects for the genders. I know, for example, for females, they're more susceptible to long-term COVID, for example. What are the other sort of gendered effects of COVID that you could share with us today, please?
Well,
and the causes thereof, actually. Sorry.
Yeah. COVID is a very tricky virus. It's a very successful virus. A lot of viruses are too successful, and it kills people off quite quickly, and therefore they don't spread, because you get it, you die. Whereas this COVID-19 is able to mask itself. It's able to sneak in. It's a tricky virus. Now, once it's in, the bodies of men and women are different. The men have got XY chromosomes, women have got XX chromosomes, and the basic immune system of the body is actually mostly focused onto the X chromosome. Now, women have got 2 X chromosomes, XX. We have 1, XY. And so therefore, women have an enhanced ability to deal with infection. We've known this for a long time, and this is now showing itself here. So biologically, I'm not going to go into all the biology of it. It's complicated. We've got a paper, and I'm sure that Damian might put a copy of the paper onto the website. But the significance of it is that women, just because they have an enhanced immune system, doesn't mean that they're immune from this. It just means that men are at slightly higher risk of getting the severe disease and from dying from it. But we're now seeing, as the disease progresses, women are also being affected with the long COVID and other issues relating to it. So we've got 2 sides of it. One is the biology of the body, and then there's the gender side of it, which is how people respond to it. And there are some issues around wearing of masks. Some men don't like wearing the mask, or they don't wear them effectively. Hand washing, some studies are showing that women are better at washing their hands than men. And that's what I'm saying before about we've just got to be careful about following the guidelines. We've got to make sure that we are doing as much as we can to try and prevent this disease taking hold.
And Alan, was it in June, July, something like 10% of men didn't believe the government guidelines? Is that correct?
Well, we've got, the problem also is we've got all sorts of surveys, we've got all sorts of scientists, right. We've got all sorts of advice and guidance, and this figure comes out and that figure comes out. And actually what I want to do is I just want to put aside a lot of that stuff and say, look after yourself, look after your family, look after your friends, and be sensible about this. This is a virus that is mostly spread by coming into contact with the virus coming through the air. And if you're in an environment where there's a lot of people and there's a lot aerosol being spread, you're at greater risk. So the wearing of the masks are significant, both in stopping spreading it and also getting it. Keeping the distance means the virus is going to travel further to get to you. Hand washing, anything that is on a surface, having your hands clean will help prevent passing it on to yourself or passing it on to others. The guidance actually is right. What we have to do is just make sure we try and follow it and hope that the vaccine comes through in the end.
Yeah, and just to clarify, by aerosol, you don't mean people at a graffiti workshop spraying, do you?
No. It's like a sneeze. It's like a cough. I mean, I know sneezing isn't part of the COVID symptoms, but coughing and laughing and shouting, where you're getting lots of air coming out of the person's mouth that have, if it's in your lungs, it's coming out in greater quantities. It is complicated, but just keep the guidelines in mind and try and follow them as best you can.
Yeah, and I suppose we're in an age where there's less faith in politics and what we're told by the authorities and things at times, and there are a lot of people out there who don't believe the guidelines or less inclined to believe it. Where do you think they could go? What could you say to them, or where could they go to get the true facts, that to avoid, maybe if they thought, I'm not listening to the politicians, where could they go instead? Or could you say something that would convince them?
The NHS is the gold standard. I mean, we are blessed with tremendous health service. The public, there's the NHS and public health, and we've got all the guidance that is coming out officially. Doesn't matter who's saying it; they're almost all saying the same thing, actually. And the World Health Organization, and you look around the world, all the countries are saying the same thing. It's not. It is a lot of very, very experienced scientists, public health specialists, all recognizing what this virus is doing and trying to give the best advice. Now, sometimes things slightly change because our understanding changes. It's like anything that is this new, what we learned at the beginning in January, February, March is different from what we knew in June, July, August, and it's now September, October, and now it's November, and then in 3 months' time. So we are learning. There's all sorts of new theories emerging, and it's not possible for the layperson to keep up to date with all the changes. And there may be a certain degree of anxiety because they feel as though the story is changing. But that is only because the scientists are doing their job.
Yeah.
They're keeping an eye on what is happening. And as things change, they're trying to keep the public aware of it. And they're trying to make sure that people are getting the best guidance that they can.
Yeah, and it's tempting, isn't it? Because I think when things are really complicated, it's tempting to go for a simple answer, and sometimes we just don't have a simple answer, do we?
No,
or the answer, the single answer. No.
Not with the only thing that's simple is try and avoid it.
Yeah.
And if you think you've got it, get it checked out. And if you have got it, stay away from others as best you can, because you don't want to pass it on.
Yeah, I think that's. Yeah.
If you see on the television anyone who's been interviewed about this, it is not nice. It's not like having a cold or having the flu. This is, if you get a severe form of it, it is really, really not nice. And for anybody who's ending up with long COVID, where it's going on for a longer time, you've got to have real compassion and sympathy for people who have got caught out with this. But try and avoid it if you can. Yeah,
and I think another thing I've come across, which has been an issue with it, is about, I think we expect a pandemic to be people sort of lying about on the streets and, crawling around and things. We have that image, don't we, of what a pandemic looks like, and this hasn't got that image, has it?
Yeah, well, we've been very successful in finding treatments for the most severe form of it, which is great, and so the death rate has fallen, but it is still going up.
Yeah,
and there are now millions of people around the world that have got this virus. Its success is its ability to transmit, and to get a foothold within a population.
Yeah.
And it's harder to deal with it because of it being so tricky. That's it.
Yeah, yeah. Well, I'm not going to keep you on too long. I know you're. Are you retired or semi-retired now? It feels like you're semi-retired to me.
Yeah, I'm still working. Still working.
Yeah.
I'm not working as much at the moment for various reasons, but I'm on the steering committee for the Unlocked, which is fantastic. So I'm able to help out. I'm able to, when I'm able to get back into Leeds, I will do so. See you all. But as we come up to International Men's Day this Thursday, and the launch of this great initiative, it's also an opportunity for me, along with you and everybody else, to recognise the positive issues that we have to be seeing in men. We have to push positive messages about what men have to offer. Often you hear very negative things about men, and I think that we have to be celebrating a lot of the stuff that happens with men that is brilliant. But we also have to reckon there's lots of issues with men that tend not to get talked about, and this is an opportunity for us to remind ourselves that there are a lot of men struggling out there, and we've got to get them in a better position, physically and healthier, so that we've got a good population going forward into the future.
Yeah, and I've got to say, at Forum Central, we're delighted to have you on board, Alan, with this. It's great to have you along, and for that matter, to have everyone who's involved in men's health in the city to join in with this. I think it's really important to get as many people involved. You know, the big and little, the great and the good, everyone, all backgrounds to get involved, and genders as well, of course.
Yeah.
Because we can't solve men's health with men alone. Obviously, we've all got a part. Everyone's got a part to play in it, I think. So if there was one thing then you could say to a man watching this, to improve their own health, we've had the COVID tip already. So leaving COVID to one side, then perhaps, what would be the one thing that you would say to a man to support his health?
Well, often that sentence starts with don't. Don't smoke, don't drink, don't.
Yeah.
I prefer to say do. And the thing I'd like to say is do care. Do care about your health. Do care about your physical health and care about your mental health. So I think one of the most significant things a man can do is to take care. And if there's something happening that's not right, get it checked out. And if you realize you've got an issue with your emotional, mental health, if you're getting angry, if you're getting frustrated, do something about it that's positive. Rather than giving a negative message, so don't, do care, seek help, do use facilities that are out there, and do talk and do share with your friends and make connections with your friends. Yeah. So and that's because social isolation, loneliness at this time is crippling, and it's just a horrible place for us to be locked down like this. And we need our friends, and we also need to keep an eye on our friends, and we need to making sure that we're being as supportive as we can be. And self-compassion. It's a hard time. Don't feel as if you've got to be the perfect person. Sometimes it's just not nice at the moment, but that you don't have to take it out on others. You just need to work with others, and because they're also struggling. Everyone is struggling through this, and we need to be compassionate to others, and we need to be compassionate to ourselves.
Yeah, that's right. And it's funny, isn't it? I think to care about your health, you have to care about yourself, and I suppose you have to feel positive about yourself. So, and I suppose in terms of the Men's Health Unlocked network, perhaps a good point now to say, that's where the network can come in handy, because you can follow us. You can follow us on Twitter at MHU Leeds, and on our Forum Central website and other avenues we're still exploring in terms of getting the news out there. But to find out what you can do about your own health, find out what services and activities are out there. If you are feeling a bit rubbish about yourself, there's some decent people out there and some decent things you can be doing that will start making you feel good again. And getting out and doing stuff is the key. Just taking a little step forward can make a lot of difference. So if anyone's listening and you're interested in just trying to make yourself feel a bit better, you feel like you want to care about yourself a bit more, you need to, then keep an eye on the Forum Central website and on the Unlocked magazine, which we're delivering in hard copy. So even if you haven't got the internet, not that you'll be watching this if you haven't, in hard copy, we'll be delivering that magazine around East and West Leeds currently, and it's also available online on the Feel Good Factor website. So there we are. There's my plug, and there is your brilliant, fantastic, and so learned and interesting sharing of knowledge for us, Alan. So thank you very much indeed for your time. And it's just lovely to have you on board. And please do keep an eye on the old Twitter feed on the day. It's hashtag IMDLeeds. If you want to join us on the day, chip it in your words of wisdom and your support. So thank you very much, Alan. Cheers.
Pleasure. All the best to you. Bye-bye.
Thank you. Bye-bye.